Hi, I am Dr. A P Nirmal Raj. I have done my specialty in prosthodontics and I am practicing at Premia Dental Care, which is at Nandi Durga Road. Fixed partial denture has been time tested. It's been there for ages right now. Various materials have been used and it is still being used successfully. So if you need to compare between an implant and a fixed partial denture, we would say that both of them are time tested and both have lasted their distance. Both are a very good option for treatment. It all depends upon what kind of patients that you get in your clinical practice. If your patient is fit enough to go for an implant, if your patient is medically fit for an implant, then I would say that going for an implant is a good form of treatment. But we must always remember the loading of the implant, whether you're going to immediately load the implant or you're going to delay it and load it. So all that depends upon the patient. If the patient is in an urgency and says, I need it quick, pretty fast, can you do it a little quick? Then I would say that you should think a lot before you place an implant, because if you don't plan correctly, you're bound to fail with an implant. So both are very good form of treatment. There is nothing like which is better. Both have been time tested. Both are amazing form of treatment. The only difference I would say is for a fixed partial denture, we use 2 abutment teeth wherein we reduce the 2 teeth and then give it as a 3-unit bridge. Whereas for an implant, you're just placing a metal titanium insert into the bone and you give a crown, wait for it to heal and give a crown. So both are very superior form of treatment and both have been very, very successful. So only thing is, for both the forms of treatment, you need to plan correctly. It depends upon the patient. It depends upon also the paying capacity of the patient, because fixed partial dentures are far less expensive when compared to an implant. Implants are far too expensive and it all depends upon various implant systems that we use in the market. So I would say that if you want to save the teeth, then implant is a good option where you don't touch the adjacent 2 teeth. Just make sure that the patient is medically fit enough for doing an implant, and always take various x-rays after placing the implant, and then if you have a good bone implant interface, then go forward with loading the implant. Do not load the implant much earlier because the patient wants it, because that is definitely bound to have failure. There are only 2 ways an implant can fail. The first step would be the implant will fail immediately after the surgery if you have not followed aseptic procedure. The second time the implant will fail even after osseointegration would be a wrong prosthesis or a wrong occlusion of the prosthesis. These are the 2 times that the implants can fail. Please plan correctly and then go forward with your treatment. Both are very superior form of treatment. Thank you.